Good morning, members of the media. Welcome to the first in a series of such news briefings, which are really aimed at putting you in a position where you can put your questions and get answers directly from some of those on the front line of the fight against COVID-19. This will involve people from the Ministry of Health, those that have been working on the issue at the University of the West Indies as well, members coming from the Barbados Association of Medical Practitioners. This morning, we have with us the Chief Medical Officer of Health, Dr. Kenneth George. We also have infectious disease specialist, Dr. Forde, and from the Barbados Association of Medical Practitioners, Dr. Adanna Grandison, who has also been serving on a committee that has been looking at home quarantine and isolation. We are going to start off with an update from the Chief Medical Officer of Health. Good morning, Dr. Kenneth George.
Can you hear me? Good morning, everyone, and a pleasant good morning to you all. I'm here to give an update as to the current situation in Barbados with respect to COVID. Barbados, the COVID trajectory continues to show a steady increase in newly confirmed cases of SARS-CoV-2 infections. The overall risk of transmission in the country continues to be very high, and there is ongoing community transmission and circulation of highly transmissible variants, which is the Delta variant. Our indices all are trending upwards. Our effective reproductive number is 1.48, which means that 10 individuals can transmit virus, very likely to 15 persons. We have a 7-day cumulative average of 641. Our 14-day cumulative average of 655 infections per 100,000 population. And we also have a 28 cumulative day average of 116 infections per 100,000. The positivity rate on all our indicators are trending upwards. Yesterday, we exceeded 200 positive cases in a 24-hour period. The age distribution of those positive cases were 22% of those individuals were under the age of 18. And in that group, 60% of that group were under the age of 12. The median age of infection is 46 years old. And this morning I learned that we indeed had another death, a 52-year-old male who died very early this morning in Harrison's Point. We have a total of 158 clusters we are looking at, 158 identified clusters. Not all of them are active, but we don't close clusters until a period of 2 weeks have passed. We continue to try with the contact tracing. The situation is such that our quarantine facilities, this morning we have 554 individuals in quarantine. And this may just be the tip of the iceberg. Most of those individuals are primary contacts, and therefore those primary contacts will lead to contact tracing. And Corey will expand on the situation within the isolation facilities. Barbadians, we are not in a good place. infection is widespread. We are seeing on a daily basis, even in today's papers, persons are not heeding the calls of public health officials. They continue to not wear masks in public places. They continue to socialize with each other very in close proximity to each other. And the issue is that the vaccine uptake is not where we would like. When we tell the public that 70%, those 70 deaths have all been unvaccinated individuals, there is no, this is the truth. We in the Ministry of Health are not at any point in time either inflating numbers, deflating numbers. We have told you that we come to you with the truth. And it's very unfortunate when we put in the public space that individuals who have died so far have been unvaccinated. There's generally a pushback from members of the public. I sincerely encourage all Barbadians who have not yet considered taking the vaccine or who are on the fence, please come forward. We have tried to expand our community-based work. We have ramped up our testing within our mobile units, and we continue to do vaccinations among shut-ins in Barbados. But we honestly need your help. We can beat this. We are in a difficult place, but I have been a very optimistic person, and I believe that the team is extremely committed. We will work on your behalf, but we really encourage you as a people to step forward in this fight. I encourage the media to try to use your wider platform to inform the Barbados public and not to be so much concerned with issues surrounding on social media, which tends to negate our message that we are trying to achieve. So I hope this update will generate some form of discussion. The main thing you need to know as persons is that we remain committed to this fight. We're doing this on your behalf. But you have to meet us halfway at some point in time. Persons are dying. And I end by extending my condolences on behalf of the Ministry of Health to that young individual, 52 years of age. If the life expectancy for a male in Barbados was 74 years of age, we lost over 20 years of life. So the decisions are in your hands, and we would hope that you take the heed and move forward with us on this journey. Thank you so much.
Thank you very much, Dr. Kenneth George. We hear next from Dr. Corey Forde.
Good morning to all Barbadians and to everyone across the wider Caribbean and to all those who are listening to me this morning. I came to the country, and I always say I only speak when I need to. And I came to the country at least 2 weeks ago. And I did say and was very clear in noting that we were about to go into a storm. For Barbadians this morning, this is where we are. I will use this opportunity to give you an update of what's going on in isolation. I don't have to say much. You see the numbers every day. But what you need to know is exactly what's going on with those numbers. All we do as healthcare professionals across the system is to try to help. We're not going to get everything right. We're not going to get everything perfect. If I said that, I would be lying. We will do the best we can. And as I say when I speak to many across the isolation facilities across this country, I tell them two clear things, two clear facts. One, we're in a difficult time. It is difficult for those who are in isolation in those isolation facilities. But to be frankly honest, and I speak from my heart this morning, it is also difficult for the staff across the facilities. It's difficult also for those in the Ministry of Health who are all working to try to make sure that we stay above those difficult clouds which you have entered. And with that this morning, I will give you an update. In our primary isolation facilities, we have a total of 29 patients. In our secondary isolation facility, we have a total of 38. And I will tell the general public that the secondary isolation is now running as a primary isolation facility. So definitely those two numbers are put together. That's the amount of sick people in this country who are in our ICU at this particular point. To bring that home to you, and as the CMO probably said, I always tell you the facts on the ground. In that facility, we have across both the primary and secondary isolation, which is practically primary, we have a total of 3 fully vaccinated individuals. We have 3 in the secondary unit who are partially vaccinated. A total of 28 in primary who are not vaccinated, and 33 who are not vaccinated. I think the numbers speak for themselves. But what I am more concerned about this morning, and it rivets me because this is where we're at in country, and we've seen across the region what has happened. And I've said, and I remember my interview 2 weeks ago, that Barbados must never look like some of the other countries across the globe. But how are we going to get to that stage? I think many of you who are listening to me this morning, I've spoken many times from inside, and I don't go scripted, I say it just as I feel. And many of you may think that COVID has come and it's gone, or it's not a reality. But in these numbers, I will tell you something. We have patients between 20 and 30 age groups. In the primary isolation, we have 2. In secondary, we have 2. If we extend that number up to age group of up to 50, that clocks a total of 16 out of that 29. That is a significant finding. If we look at the amount of those individuals who have no comorbidities, that takes us up now of significance, but that takes us up to about 14 who have none. That speaks volumes. So in the past, where we had people, yes, with diabetes and hypertension, you see deaths which are coming out with regards to that. We're now looking at a different factor. That age group is no big bridge to whether or not you end up in primary isolation. And it's what we do out there, certainly as fellow citizens, that will either we will get through this storm, or we will get to the eye of the storm and have a calm, or we will not. But I just also want to take you a little bit further, so just to be really complete on what I give you this morning. So if we look at those who are severe in our primary isolation area, we have a total of 22 persons with severe disease. And you might not understand what that means. That basically means that people are on ventilators, but they may not be intubated. Meaning, when they say intubation, it means put that tube down your mouth and the machine breathes for you, because that's the only way you'll survive. 7 of those are critical on ventilators, and 22, as I said before, are on 21, as I said before, are on ventilators. And this is now the other part of this information, which I think is very, very important. In the secondary isolation area, which is now primary, we have a total of 17 of those cases which I've mentioned are severe disease. None are critical, because we wouldn't normally have ventilated patients by tubing in there, but that might happen as the way how things are going. And the others, 21, are considered to be moderate disease, which means they're at that point where they may go over into severe disease. And our aim is honestly to try to prevent that as much as possible from happening. I'm going to tell you in the end how you might help us with that. In if you look at the whole system in general, we have a total of 21 persons on non-invasive ventilation. That means you put the mask on and try to get oxygen along as best as we can. 7, as I said before, are ventilated. So what does that mean for you as average Barbadians? What does this information mean? Because I just give you numbers. And numbers are important. Everybody wants to know statistics and details. What it means is that we are in the midst of a storm. And where we go in the midst of this storm, as I said 2 weeks ago, when I saw this coming, I said very clearly, look, I need to talk to people. Because I think we're at that point where if we get this wrong, we're going to look like some of the countries across the globe that we pray we never look like. The Indias, we all know what that looked like. The US at parts, the UK at parts. But we can do this. We can pull this back. This is a message this morning to Barbadians of hope. And that message of hope will come from your actions. What you decide to do at this stage will impact very, very clearly what happens across this country. These figures are real. And I love the fact that some of the media, although I know it was tricky for them, were able to actually go in and see for themselves. I think seeing is believing. And show you some of those pictures of what we're faced with on a day-to-day basis, and show you what those challenges are. Across the facilities, there have been challenges. Straightforward. I always say, I've told the general public, when we get it wrong, I will say we get it wrong, right? And figure out a way to fix things. It has been a difficult time, and no country across the globe has gotten this right. But we will do every single thing. I assure you this morning, we as a team in this country of persons caring for COVID, whether you have mild disease, no disease, or severe disease, or critical disease, we will do every single thing in our power with the resources we have, and many of us have not slept for nights in the last few days. I'm a tired man this morning from last night. And in the background, if I may share publicly, with my dog dying, which is very close to me, that took me for 6 this morning. But despite all of those things, our general aim is to ensure that every single Barbadian is safe. And in going into home isolation, as it's going to be discussed shortly, we also are going to do that with a level of safety, understanding that with any system, whether you put it in place, there may be challenges. Yes, people may get sick, and we will try to have systems in place to deal with that as we go about that particular process. This is a very difficult time in country. And I am just going to be inspired to say this. This is not planned. It just came to my head. And I'm asking, I'm not the CMO, I'm not, a minister, I'm not government, don't get involved in politics, but I'm led to say this, and forgive me for those who may get upset this morning. But I'm led to say this. When I'm led to say something, I will say, and I'm going to say this, I am asking for all Barbadians on this call, and for all the church leaders in this country, for all those who are Muslims, for all those who are Hindu, for whatever religion you are in this country this morning, that on Friday, between Friday and Saturday, however it's worked out, you decide to pray for this country. Pray for this country that we go in the right path. I'm asking for all groups to get together this morning. This is not planned. This is just how I'm led to do things. And I'm asking all religions, whatever faith you're from, even if you're non-religious, to pray for this country and for all the healthcare workers and for all of those who are sick and for all of those who have died and their families. I ask you to pray for this country between Friday and Saturday. However it's organized, somebody step forward, organize this. Let's have that in this country. I think that we need that at this particular point, and to ask God's guidance on everything that we're doing as medical practitioners. Thank you.
Dr. Forde, thank you. Before we go to Dr. Adanna Grandison, could you give us some sense of the overall numbers that you're dealing with right now? Because they influence the move towards home quarantine and home isolation.
Give me 1 second. Right, so we have, as you would well know, based on the numbers that we have greater than 1,000 persons that we're following in isolation, whether it be in facilities that is known, or in a few cases for private isolation. So we have greater than 1,000 individuals. That is significant. That is a significant number. You have noted yesterday that the number of persons who were found positive, we broke the 200 barrier. And it's quite likely that we will break that barrier again. It is what we do, like I said before, on the ground that will influence that. So I think those are the numbers. Once you breach 1,000 persons isolation, I think the general public has to understand. I take the opportunity to say this. Yeah? The general public has to understand things will not be normal. We are not living in normal times. And I'm glad, David, that you gave me the opportunity to say that. Because once you breach that number, one has to match medical care with the amount of medical care professionals, with the amount of hours that they're working. So things are not going to be normal. But we will do everything that we possibly can to ensure they are. So if you don't get your meal a little bit on time, don't get mad. Things are not normal. We will try every single possible thing we can to ensure that it is. But if there's some you want to point to us that you think that we can get better, even with these numbers, I want you to do it. But do it in the right way. I think we have to work together. And David, to be straightforward, we have to work together as a country despite the divisions and whatever you think. Whether you don't want to get vaccinated or not, I encourage you to. But if you don't want to, I believe it's a choice. But I encourage you to. But I think the end point is this, as even as we go into this whole idea of isolation, I think I'll take this nicely into Dr. Grandison's discussion, is that even as we're going into that discussion about home isolation, whether this works or not, it's still going to come back depending on what people do when they're there. If people go into home isolation, all the different brilliant parameters you have in place, Dr. Grandison, to work, and people decide to breach them, we're going to end back in the same problem. And I said something on the isolation facilities before, which I think that it goes above healthcare. And as I meet with patients, and they'll tell you, I go around and I try to talk to everyone, even though times are difficult and I'm very busy, I think that's important. But I keep telling them something. People see now where we are, and I think that that's part of the problem. You only see now, but you don't see if you get it wrong, what could happen. The little kids that I mentioned and I point out in the isolation facilities, what we do as adults will affect them in the future. If we get this wrong, and all the businesses are shut down, and you can't go to work, and you can't go to church, which is people's relief, right? And you can't, go to parks, and you can't go to cinemas because of things that we all do and can't get right. It impacts a whole community, right? It impacts, I'm not a politician, certainly not an economist, but it impacts the whole economy, right? So I think that's where we are at. We are at that stage where we've entered the storm, and it's very turbulent. And whether things stabilize or not is dependent on what we do, yes, as healthcare professionals, to get you to that point, and the advice that we give and the action from policymakers. But a large part of the action will come from you. Straightforward, straight. Whether you're vaccinated or not, we know the figures speak for themselves. The figures speak for all the other Caribbeans for themselves. The figures speak in the US for themselves. The figures speak in UK for themselves. The figures speak as far as China for themselves. But it's what we do when we get to this sort of numbers that will impact what happens to us in the future. Don't think about now, think about the future. I tell you this morning to think positive, but stay negative. That's it for me. Thanks.
Let's hear next from Dr. Adanna Grandison. Good morning.
Good morning. Can you hear me? Good morning, Barbados. I want to say, first of all, that as Dr. Forde and Dr. George has stated, we are in a very different space. But with the introduction and the implementation of the home quarantine and home isolation, we will be attempting to safely allow persons to stay at home. I first want to start off by giving a bit of clarity about the differences between the two programs, the home quarantine program and the home isolation, and really why we have taken this move to do such, because we know on social media we are hearing persons say, oh, all of a sudden they're releasing us back out, they don't care about us, and that is not true. Right? At every single step of the way, both for the home quarantine or home isolation program, we have medical professionals, whether they are doctors, nurses, paramedics, who will be in contact with each and every single person in the program. So, in terms of quarantine, what does quarantine really mean? We are looking at a patient who essentially has a COVID indeterminate status. We don't know what their COVID status is. We know for the home quarantine program specifically that this is a primary contact. This is someone who has been exposed, and so we want to at least remove them from community in terms of interacting with other persons and allow them to essentially manifest if they are going to become positive or hopefully stay negative. At the end of that quarantine period, we will test those persons with a PCR test, which is the gold standard for testing. And provided that that person is clear, or they have a negative test, so that I'm very clear in terms of what I'm saying, that person is then released and can move around freely. we encourage you, even though you were allowed now to move around freely, to continue every single day after that, essentially masking up, wearing your mask properly, wearing it above your nose, covering your mouth, ensuring to wash your hands, and physically distancing. For those persons who may become positive, they will be assessed by Dr. Corey Forde and his team at the isolation facilities. Now, there are some considerations for persons who wish to also isolate at home, but we need to ensure that safety is paramount. And so what we will encourage is for persons, after they have been assessed, we find out, we take a good history of you, and we encourage you, please, to be very honest when you get a history taken. Tell us about your symptoms. So if you have any runny nose, if you have any sore throat, if you've had any cough, and try to really document. If you can keep a small little diary, we have phones now, so if you want to keep it, okay, well, I started to have my cough from Thursday, at least just put it in your calendar. Make it very easy on yourself. And then certainly we want to also know what your comorbidity profile is. Why do we want to know this? Because persons who have comorbidities, for instance, comorbidities such as hypertension, especially poorly controlled hypertension, diabetes, poorly controlled diabetes, heart disease, respiratory disease. We've also found that persons who are obese or any immune suppressed persons, these are persons who we need to monitor closely, simply because they have the possibility of deteriorating or getting very ill very quickly. It doesn't increase your risk of contracting COVID, but it does increase your risk of deteriorating if you should get COVID. And so we ask that you be very clear in terms of allowing the medical professionals to know exactly what comorbidities you have, so that we know, okay, we need to ensure to check in with Marjorie or Sandra or John a little bit more frequently. So once you have been assessed by Dr. Corey Forde and his team, he'll make a determination about your status in terms of symptomatology, in terms of comorbidity profile, and we also want to look at vaccination status. Why are we looking at this? Simply because the research has shown very clearly that persons who are vaccinated, even if they become infected, and I want to take a step back here in terms of why a person who has become vaccinated can still be infected, not necessarily presenting with symptoms, however. A person who's vaccinated generally with, and this is the intramuscular shot in the arm, will produce an IgG response, big fancy term for the type of immune response that you would have. Now, in the back of your nose, where we take the swab from, the type of immune response that we will generate there is a different type. It's an IgA response. And so we may still find virus there, but we do not expect that person, because the vaccinated person essentially will have mounted an immune response, an IgG response, that even if they got infected in the nose, that it will not then essentially evolve into very severe disease affecting the lungs, the very organs that we need to help us breathe and to help us get better. So when essentially that occurs, we expect that person who has been vaccinated to recuperate a lot faster. Therefore, the risk for a vaccinated person is a lot lower. And so, provided that you are not symptomatic, because we do have a few breakthrough cases, even with persons who are vaccinated, meaning they become symptomatic, they can get ill. We have very few cases of that. Those persons, and this is not something new, I should say, because this here can happen with hepatitis B. It has happened personally, and I'll share a personal experience. It happened personally with me with my varicella shot. As a healthcare provider, you're supposed to get 2 chickenpox shots. I got both. When I was going away to do my elective, I ended up still not having enough of an immune response, and I had to go back and get additional top up in terms of a booster shot for varicella. And we do all of this in an attempt to keep persons safe. So if you do have a vaccine, we think that the risk that is associated with a person who's vaccinated in terms of getting worse will be a lot more decreased. And so once that risk stratification has been done by Dr. Corey Forde and his team, then you can after a short stay within the isolation facility, you can apply for home isolation. Once approved, again, this person will now be allowed to safely isolate at home with the constant monitoring of healthcare professionals. It will occur daily. It will occur at random. In addition to that, we also have technological measures in place in terms of GPS monitoring bracelets to ensure that you do what you're supposed to do. Yes, we expect that you will be honest and you will stay home, but we want to put that additional mechanism in place to ensure that persons stay at home and do what they're supposed to do. On top of that, there's another layer, which we will have random check-ins with healthcare professionals who may, for instance, not necessarily turn up at your door and knock on it, but may ask you just to present yourself to the door to ensure that you are there and what we are seeing is actually true. Okay, all of these are mechanisms to ensure the safety, and this is something that has been done in a lot of international countries. We've seen this here in Canada. We've seen home isolation, home quarantine programs in Australia. This is not anything new, but we want to ensure that we're coupling both the safety in terms of healthcare, health professional backup, in addition to technological implementation. Once you have safely undergone your home assessment, your symptoms have resolved, and we assess you every single day, and we believe that you have recovered based upon the trajectory that we have seen for cases, Delta cases, Alpha cases, then we know that you are now safe to leave isolation. There are certain criteria in accordance with WHO that we use to essentially leave isolation and now be considered safe to return to community. And essentially that's what the program is all about, allowing you the comfort of being in your home, but also ensuring that you are safe not only to yourself, but also to the community.
Dr. Grandison, we now invite questions from members of the media. Please identify yourself as you pose your question.
Question for Chief Medical Officer, Dr. George. Dr. George, good morning. Can you give the country an indication what your contact tracing investigations have discovered as it relates to the number of young people that are becoming infected with COVID-19? In other words, have your investigations determined how so many young people are becoming infected? Are they going out away from their homes into clusters, or are elderly relatives bringing home infections and causing them to get COVID-19? What is the information telling you so far?
Thank you. So with respect to those clusters that I spoke about, we have the following. It's very ubiquitous across Barbados. A lot of the cases are located throughout the island, but concentrated in the urban corridor. We have gas stations, fast food restaurants, security companies, manufacturing businesses, both large and small, nursing homes, daycare institutions, the Queen Elizabeth Hospital, the laundromat, a hardware store, a mosque, and the Royal Barbados Police Force. No community is spared. And therefore, to your question with respect to what is the breakdown of young people versus older people within these clusters, what I would tell you is that information can be provided, but no individuals are being spared of this COVID pandemic. And I want to be extremely clear about that. We have at present 72 individuals from yesterday that have not been assigned to any form of cluster. The more clusters we get, the more difficult it is to do contact tracing, because you are going from pillar to post trying to find the individuals that in a situation where numbers are mushrooming. And that is the challenge. However, on the brighter side, I must say that The medical officers of health have been working extremely diligently in this area, and they try where possible to identify the contacts and place them in quarantine. In quarantine currently, we have 9 properties that are quarantine hotels, and as Dr. Grandison has indicated, with the advent of home quarantine, it gives us a bit more space to operate in this type of environment. And it also renders the hope that families that come down with COVID can be managed in a single space, particularly if they are quarantined, if they can be quarantined, or if they can be isolated, where the case may be. So I think that the home quarantine and home isolation does offer a new avenue for Barbadians. I just would like to reiterate what Dr. Grandison said. Our primary focus in the ministry is to make sure that quarantine sites and isolation sites within the country of Barbados are safe. And we are taking special measures to make sure that those individuals who have been identified as candidates for this purpose, that they remain in their homes during the quarantine or isolation period. This will not work if we have individuals who hope to use this new facility to do what they want. It requires full cooperation from the individuals who are placed in home quarantine and home isolation. We are choosing these persons using very specific criteria, and once those criteria are met, you are expected to comply. If you there will be a consent form that you will be required to sign, indicating to us that you understand the terms and conditions of your home quarantine and home isolation. Thank you.
George, and just a quick follow-up question. Our capacity in terms of isolation and quarantine, are we full, or do we still have some space left?
So Corey can speak to the issues under his purview and under his remit. I've reviewed the report today. We have 92 beds available in quarantine. Please recall that some will involve families being quarantined, so they can be housed in a fairly single space if we're quarantining a whole family. Because if we're quarantining a whole family, we're not going to individually quarantine those individuals. That doesn't make too much sense. So we have a small bit of latitude within our quarantine facilities. But I think that Corey will be well positioned to speak on the issue of isolation, but I know things are not good on his side. Thank you.
Morning again. Thanks, Barry, for that question. Barry, I think you know me very well by now. I hate to give specific numbers because by the time I get off, today, the numbers are going to be different. As people are coming in, all now from some 6 this morning, again, as we speak. But when I left things, we had at least 90 beds or so around our admitting facilities, and there were discharges occurring. So that number is going to change and fluctuate as the time goes by. So by the time I get off that call, the number might be less. But the truth is that we are stretched, and we're not only stretched in terms of numbers, we're stretched in terms of doctors. I lost one of my doctors yesterday in terms of being ill. And another one is going to go off for their own personal stuff. And that's really where we're at in country. And I think there's a lot of effort, I know, being done now to try to help us across the facilities where that is concerned in terms of medical, providing medical care, etc. But I think if we look at it as a global picture based on what you've answered, I think the response to home isolation is not necessarily a result of the numbers that we're seeing, because we could open 10 more schools. But I think there comes a point in part of that surge plan that was planned on the ground, and once their facilities met at least 5 facilities or more met at least 80% occupancy, and certainly greater than 60% occupancy in your ICU, you knew you're going to be challenged. Whether numbers were up or down, you knew you're specifically going to be challenged. And I think coming out from that is the other point. As you go into home isolation, I always said and will continue to say that one of the things that made Barbados very different from the rest of the world was that idea, which many countries didn't, some in Africa did as well, was this whole idea of isolation. And I'll give you a bit of my experience on the ground in understanding that. So what you have to do, as going to be done in this process, Dr. Grandison was brilliant in explaining that, is look, where you're going to try to risk stratify people. And I think this morning, people are going to rush to say, I want to go into home isolation, but there are very specific criteria which you'll gather more and more information about over the next few days as more and more people speak about it, that has to be followed. So don't think, okay, because I'm in a facility, I can leave tomorrow and go into home isolation. It doesn't work like that. It's a very specific process that has to occur. There are very specific criteria, whether you're asymptomatic, symptomatic, or if you've been pre-symptomatic, or if you have comorbidities or not. So all of those things will make a play, because I will tell you something, and people keep saying it, but it's reality. COVID is no respect of age. And it's now, you see, when the data I presented to you this morning, it's probably even no respect of comorbidities. So whether or not you go home in home isolation does not mean that you can't get sick. I know that if you're vaccinated and go home, the probability of you ending up in my ICU, based on the numbers we're seeing here today, is there. The likelihood is less. So we have to really risk stratify how we send people home. But people also need to understand as well, it's not just everybody goes home and you hope they stay home. There are mechanisms that are going to be in place that there'll be further discussion on with the public during time. So this is a very important question to ask in terms of our isolation facilities and whether we're stretched. And we are. The people in the facilities are tired, and I will take the opportunity, if I'm allowed, and I'll be talking for a little while, but to say, look, I know you're tired. I know you're in the facilities. I know sometimes you get frustrated, and we try to hold things together for you as much as we can. But I also like to tell you this morning, despite that stress, and I said it 2 weeks ago, because I saw it coming like a storm. I saw it coming. Even though you're stressing facilities, there have been some incidents in some of the facilities that have not led to some other people being comfortable in facilities. People fighting. Honestly, we got to do better than that. We are better than that as citizens of this country. To have young people fighting in facilities, when people are fighting for their life in ICU, that makes no sense. Fighting, I don't think we can tolerate. Other issues, I need to bring to forward. Most of the facilities are communal settings, and it's difficult. If you have to live if you went overseas and studied like me, I lived with many people. It's difficult because everybody's from a different culture, different walks of life, and you bring people together. But you know what? Like I said before, we have to go into this, as I tell people in the facilities, we have to go into this as a country. My team can go in and clean 20 hours, but if somebody doesn't flush the toilet or decide to do something that's not the best way, then things are difficult. These are difficult times. And so as we go through these difficult times, as the numbers increase, the facilities become full, it's going to be a challenge. They're not the Ritz-Carlton, they're not the Hilton, and they're certainly not the Marriott. But we will do every single thing in our part to make you as comfortable as we can. And sometimes we have to shift people around based on various circumstances. But bear with us. Work with us in these difficult times. You know what? We'll get to the middle of the storm, the eye of the storm. We'll get to that camp stage. And I hope as we go into the next phase that if we have a lot of vaccinated people in this country, that we're going to smile through the next phase. Thanks.
Next question.
Good morning, Carol Toppin from Starcom Network. I just want to know, realistically, with the opening of several isolation centers and what we had before, also looking at home isolation, realistically, how are we going to maintain, how are we going to keep up with all of this? Because in one of the previous press conferences, we would have heard that resources, as in human resources, nurses, doctors, were very, very limited. So realistically, how are we going to manage this? And secondly, what is all of this going to be costing us? Because every facility, you have to equip the facilities, you have to have people to man the facilities. When you add home isolation on top of that, then you're going to have more medical personnel going out to check on individuals, probably even more policing, literally, to keep people in place. So realistically, how are we going to manage this? And secondly, what is this going to cost us?
With respect to the cost, I am not authority to speak to cost. What I would say is that the Ministry of Health, you may be aware that there was a large supplemental that was processed in Parliament and approved, and a significant amount of that contribution was for healthcare in all its forms and fashions. We have increased several categories of staff, from whether it be CHLOs, primary care physicians, nurses on the front line, etc. But the challenge is that we do have a finite population, and therefore human resources will continue to be a bugbear moving forward. The Prime Minister recently announced that there will be some clinical staff that will be joining us very shortly from the United States. That will add a short-term approach. We continue to rely heavily on the Cuban trained nurses to assist with respect to our swabbing. And we have taken on some additional medical and nursing staff. But you are right, and that is why requests have gone out to the diaspora, asking individuals to come and help Barbados in our time of need, even for a short period of time. That will be helpful, because we absolutely know that we can get over this hump. But you're right, we have increased the number of quarantine sites, the number of isolation sites. So that's only part of the equation. The other part of the equation, which is also important, is public cooperation. And I think that too many times everyone looks to the Ministry of Health for all the solutions. That cannot be. We are only looking at one side of this equation. The public needs to be engaged, and they need to meet us, even if it is quarter way. It can't be the state being the responsible agency. COVID is about behavioral change. And if you don't try to change behaviors and harness different ways of thinking, we are going to be in a tight spot. And finally, the other issue we use in public health are the restrictions. And you in the communities are very aware of the current restrictions that we have put in place. There's a curfew. There's a limit on persons gathering. There's a limit on persons in churches and places of worship. The schools are not doing face-to-face. So that it is three aspects to this approach. And if you have a three-legged stool and one leg is off, we're going to be in trouble. And that is all I am asking, that it takes a fiddle to you must have a fiddle if you want to fiddle. And these things are important and should be considered. So don't believe that all, for any one point in time, that all the solutions to the COVID problem in Barbados needs to be put at the government of Barbados or at the Ministry of Health. Thank you.
We'll take another question.
Good morning. Sorry, go ahead, Carol.
I just wanted to ask quickly, are you satisfied with what's happening as it relates to our borders, visitors coming in and their vaccination status, but more importantly, their compliance to what we are doing or what we're trying to do here in Barbados? So I'm not sure if the CMO will answer that, or maybe Dr. Forde, as it relates to people coming to Barbados.
Let me be clear. The spread of COVID is among the average Barbadian in Barbados. We, on a daily basis, are getting between 1 to 5% of cases coming in our total mix. All of those numbers for the 223 yesterday, of that, I think there were 213 individuals who were locals. The infection is within the communities across Barbados. Our ability to pick up tourists who travel to Barbados, we still have that operational and it is fully functioning. So the standard is if you're vaccinated, the day of your arrival, you have a test in country. If you are not vaccinated, you wait 5 days in quarantine and test on day 6. That is the protocol which is currently being adhered to and maintained. But with respect to the feeling that this pandemic is the average Barbadian households where people work, where people worship, those types of environments. So if in the initial stages in the pandemic, it was brought in on a flight, the epidemic in Barbados is certainly within the country and within our borders. It should not be blamed on an external source at this point in time.
Next question.
Good morning, Sharika Griffith from CBC. This question is for Dr. Forde. With over 1,000 people in isolation, what is the current doctor to patient ratio in the isolation facilities? That's my first question. And I'd also like to know what is our current stock of ventilators. I believe you mentioned that there are over 20 people who are currently ventilated. How does that compare to what we currently have on island?
Good morning. Again, thanks for your question. I think it's often difficult, as I said before, to answer questions of that nature. But what I would say, the doctor to patient ratio is going to be challenging. At each of the facilities, at the admission facilities, we have at least 2 doctors. When the Cubans are on, sometimes there are 3, but most often 2 doctors at the tertiary isolation area, at the facility at Harson's Point, and at the Black Mongolop, that's much of the same. At the primary isolation facility, we have 2 consultant infection and ICU individuals, and then we have a total of 4 resident doctors who are there for most part. And that, right now, we're working to improve on that because, again, like I said, I was very clear, very clear. Clear as mud in saying that I think when you rise to those sort of numbers in your ICU, you definitively need assistance, and I believe some assistance is on the way where that's concerned. At the Alta facilities, there's 1 doctor there. I try to shuffle between all those facilities. That is not sustainable. We definitely need more help, but I know that for sure, certainly for internal discussions, that we will have help on the way where that's concerned. And I think that is important to mention because there's obviously an element of burnout of the physicians. People are tired. They still have to do their normal lives. We were discussing that only yesterday. I always get very personal on TV, and I'm sorry, but that's just how I am. And we were discussing that the other day. We were discussing I'm not able to pay my Digicel bill. I'm not able to pay my electricity bill. I saw it come in and say final notice. I'm like, oh boy. This is almost 2 months. So those are the things, and that's reality for me on the ground. That's reality for many of us on the ground. Our normal thing, I can't even get to go to the bank to do anything. So this is the reality of how we are on the ground. Like I said before, I just want you to understand this, right? And I know you as media, sometimes some things are salacious, so you run with them. But I'll tell you, right? I'll tell you, these are not normal times. And so things are different. And I think I answered the part with the amount of doctors, but I can't remember the other part of the question.
Ventilators was the other one.
What's that?
She asked about ventilators.
Or the amount of ventilators. So the amount of ventilators, we did an audit of our ventilators. We had many ventilators being donated by some very popular people in Barbados. We have a total of, I hate to give numbers because again this changes, but we have greater than 100 ventilators, an island spread between Harsons Point and the QEH hospital at this point.
Dr. Forde, if I may ask a question on this matter, it has to do with where we are, because you projected that we were going to be facing a storm 2 weeks ago. The question is, to what extent are the figures that we are seeing right now consistent with what we anticipated, and where do you see this situation taking us in another 2 weeks?
Yes, I think this is a very important question, David, and I tackle on in the journalist's question. We, as I said before when I started to speak, is that we have entered the storm. We ain't hit the part where the thunder is hitting and the plane is falling, but we have entered as a bumpy time of the start. We're nowhere there, and we will not look straightforward again. We will look no different than the rest of the world in terms of issues with ventilators. And I said it, David, while I was talking to you at Harsons Point, it was very clear in saying, I do not know, I cannot predict if we as a country will have enough ventilators in country, whether we brought in 100 tomorrow or we brought in 1,000 overnight, if we will have enough ventilators in this country to support care of every single person, along with the medical, if we bring people from Timbuktu, right? If we as a country don't understand that we need to keep your mask on, get vaccinated, because those are the two things that will prevent me from using ventilators, prevent Dr. Hassel and Dr. Lovell from using ventilators in Harsons Point. Those are the things that we know for sure, 100% sure this morning, 100% sure. Those are the things that we know that will stop that need for 1,000 ventilators, for 200 ventilators, for 300 ventilators, for 5,000 ventilators. Those are the things that we know that will make a difference, Barbadians. This is what I know, and this is what we know. And I think if we look at it from that perspective, that you can impact how much ventilators, you can impact the stress on the system. You have the capacity to do that. But you have to make that choice this morning. You have to make the choice whether you get vaccinated or not. And I will go further to say this, that many of the cases that we've seen that have come up more recently, and so we've been managing some of these more difficult cases at some of these different sites. I've been trying to take a bit of pressure off of my colleagues in primary isolation and secondary isolation. They're stretched the capacity, right? And I've been trying to take the pressure. I'm managing some of these on the outer sites the best we can. But the point, going back to say, is this: it is what people have been doing sometimes that have led to this. I've said before 2 weeks ago, very clear, very, very clear, 2 weeks ago at this point, we often as Barbadians, you think about you as an individual, but you don't think about old granny who's in the house, or your aunties in the house, or big families in the house. And what we've been seeing is you see a lot of these deaths that happened recently. What we've been seeing is that people sometimes bring it in, right? And some of these persons in the house are not vaccinated. And I think one of the things, I don't want to say it's a criticism of our own system, but I think there are methods and way we can do to improve things. We have to get to those people. We have to get to those older people who need to be vaccinated. And I think that's where the drive has to be, because over the last few times you see people come from outside, they bring it into their households, the working population, that large population of people, and they bring it into old granny in the house. And old granny is up in ICU on oxygen or in a ventilator. So this is exactly what's happening. And I really, really, really want you to understand that, and to understand that you can impact that change in the amount of ventilators that have to be used. You can do that. So as somebody's mentioned before about money and costs, but I think the cost, I cannot put a cost to saving somebody's life. And that's straight up. I cannot put a cost on anybody's life. So what we do, even if we have to increase costs to save somebody's life, is fine. But again, the public has the capacity in this particular case to impact the amount of money that we actually spend. And I think this is very, very important. Thank you.
Dr. George, you wanted to make a comment as well?
Yes, I want to follow up. Corey, you spoke about personal sacrifice, and You know, the team is an amazing team, but Corey has been here with us for every step of the way. But there are a lot of unsung heroes. They are the medical officers of health, the contact tracers, the public health nurses who have all decided to band together and add value to our vaccine response by working sometimes up to 9 p.m. at night. Persons in environmental health who have gone beyond the call of duty. Our CHLOs, our community health liaison officers, who have been supporting Mr. Chapman and his team. Our quarantine engagement unit that reaches out to hotels and other business houses, making sure that persons remain in quarantine and they do some due diligence efforts. Our hotline unit, which ensures that the visitors' questions are being asked on a daily basis. And then finally, we recently inaugurated a cell within the Ministry of Health, which is based on logistics and operations. This operations is a 16-hour operations every single day beginning at 6 a.m. and is responsible for the coordination of all things COVID in Barbados. These are the realities. It is not CMO in front or Dr. Forde in front. There's a tremendous team that works extremely hard. The other person that comes to mind is Mr. Alvin Hart, who has been coordinating our efforts in quarantine on a daily basis. And there are a lot of other individuals. So this is a highly complex operation. It involves tremendous human resources and organizations. It is not haphazard in any fashion or form. And with the contribution of the government of Barbados to this effort, I only ask you to do your part, because I believe that if, as Corey said, if we have issues, there was a video on Blackman and Gollop, there will always be issues in any battle. There will always be issues. You're not going to get a situation where you're going to go to an isolation facility and consider it a hotel. It is not going to occur. Bear with us. But just know that it is not only the CMO and Dr. Forde, but there are several other individuals who are toiling behind the scenes and trying to make Barbados a safer place.
I want to
Thank
put
you.
the next question to Dr. Adanna Grandison, and it has to do with the call for people to be vaccinated. Given the surge that we are into, explain how much time would it take for persons who are now vaccinated to be fully protected, and therefore what implications does that have for the surge that is now on?
Thank you very much, Mr. Ellis, for that question. I think it's a very important concept to grasp, because we tend to think that if we get our vaccine, our first vaccine, we've gotten our second vaccine, if it is a 2-course vaccine, that immediately, I am now protected. But we do know that we have partial protection, and that usually takes, after the first dose, that usually takes approximately 14 days, because we still need for the body to recognize what is foreign in the body and essentially start to try to get at that foreign entity and kill it within the human body. Vaccines are really used to peak the immune system. And so after the first dose, we have that response. And then essentially for the 2-dose shot, we give another dose that will again ask the body, are you sure you really recognize who this is? Let's see how quickly you will respond the second time around. And so for the second shot, that will also take approximately 2 weeks to mount a response. I know that a lot of persons, for instance, would have said, well, I've gotten especially for the AstraZeneca vaccine, I've gotten the first dose and I had some side effects. Now, we expect that you will have side effects because your immune system is recognizing that there is something foreign there, and it will go through what any immune system will do once an immune system is functioning properly. So you will have certain things that what we refer to in medicine as an inflammatory response. You will get a fever, you will feel a little increased temperature at the site of injection, you may get a little pain at the site of injection. These are all things that reassure you, haha, my immune system is really working. With the Pfizer vaccine, most persons tend not to get that response with the first shot, the first dose of the vaccine, but they get a more robust response usually with the second dose of the vaccine. So what you do now and today, your coverage is really impacted in 2 weeks. And so that is why, and even when we are looking at the statistics and the data, what we are seeing now has an impact on how bad things or good, depending upon what we do, can be in about 2 weeks. Anytime that we see something here and we get concerned, that's why Dr. Forde easily said, I can see it coming, because what we're seeing on day 5, we know 2 weeks from day 5, based upon what we're seeing, has an impact on 2 weeks from now. I also want to state, just following on from what Dr. Forde said, I think it is really important because we can, to a certain extent, in terms of the general population, and I say we because we are in this together, we can affect how many persons can become potentially severe. And how do we do that? We need to normalize things like testing. A lot of persons get very scared and concerned. Oh, well, I just have a little sinus drip. I just have a sore throat. But you know, the dust outside, the Sahara dust outside is really bothering me. So that's it. If you've noticed a change in your presentation of what you know is your baseline, go and get tested. Know your status. Don't be scared to get tested. The test is not a painful test. It is uncomfortable, I would admit. It almost feels like if you've gone to the beach and salt water has gone into the back of your nose, and it sort of feels a little uncomfortable for a few seconds. And that after a few seconds, that goes. Okay? It is something that I think we should start normalizing to ensure that persons remain safe, so that if you start to get symptoms, we can identify you early, we can intervene as healthcare professionals early and offer you the best possible chance of not getting worse. If you present to hospital very, very late, or you present for testing very, very late, or you have lots of symptoms, now feeling short of breath, and that is because now it's affecting the lungs, it's no longer in the top, upper respiratory tract symptomatology, it's now going down into the lungs and affecting the lungs, then it's very, very, very difficult for healthcare professionals to really help you a lot, as much as we would like to. And healthcare professionals, we're in the job to help you. That's why we went into it. I certainly have a passion for helping persons. And as Dr. Forde said, quite often as healthcare professionals, we tend to put others before ourselves. We forget about the bills, we forget about eating, we even forget about doing some very easy or rather simple physiological things, because we're always thinking patient first, deal with the patient, and then you can always deal with yourself. And I think it is important that we ask you, I'm begging you really to essentially present early, get tested if you've noticed any change in how your normal day goes. You wake up with a headache, and this headache has been going on. This is not what I am accustomed to, or I have a sinus drip. Go out, get tested, know your status.
Now, Dr. George, when you were identifying the clusters in the country, you identified the QEH as being among these clusters. Can you share with the public what you see as the implications of that?
There is COVID in widespread communities and business houses in Barbados. So I don't want the press to ever believe that it is a story, because I get so many calls. Oh, there's COVID in this business. You know, it's like sometimes even a gotcha. We are aware. When we have an issue in the hospital, I can just be very brief on this. We make every effort to remove those individuals, bring in extra staff, and let the functioning of the facility continues. On the Queen Elizabeth Hospital, we are extremely stressed at the moment. The accident and emergency department is under tremendous pressure because they see not only the spillover from COVID, but they are individuals who are coming with the standard heart attacks, pulmonary embolism, diabetic foot, those type of issues. And those services must be preserved. So if QEH has had several brushes with COVID, the psychiatric hospital, the same thing. The geriatric hospital, the same thing. We need not to concentrate on where the COVID is. We need as a people to do better. Let the healthcare authorities decide and make the changes with respect to where the COVID is and our approach to that, because we're gonna try to handle those situations. But when we have widespread community spread in Barbados, this COVID, it is becoming ubiquitous. And therefore, I ask again, let the healthcare professionals do what the healthcare professionals do best. And let the country cooperate with us along this journey. Thank you.
Let me apologize for the media, but they have just been knocked off of their communication with us. And in the meantime, I will try to carry the load until they come back. I recognize that there has been divided opinion, doctors, on this question of to lock down or not to lock down. When COVID has reached this kind of community spread in a country like Barbados, what are the pros and cons associated with locking down or not locking down? Dr. Grandison, how do you see it?
So, just like every single thing in medicine, there are benefits and there are risks, right? When it comes to locking down, and every single time that BAMP has made a recommendation for stricter measures, lockdown, that has been with the safety of persons at the forefront. We have suggested these measures, especially when we start to see certain trends. And it is because we are aware of the limitations of our society and the limitations of the human resource that we have here locally within our healthcare professionals. As Dr. Corey Forde said, you know, doctors, nurses, down to the orderlies that are working in these facilities, they're burnt out, they're tired, they haven't had vacation, and these are all things that we need to be mindful of. And in order to have any very seamlessly functioning center, healthcare facility, there really needs to be redundancy in that system. And so, given that we do have that limitation, it is a very significant concern for BAMP. Now, on the contrary side, we know that there are some subspecialties in terms within our healthcare profession. For instance, the psychiatrists and the psychologists, certainly, that will be concerned about the mental well-being of persons. Given that we are in a very uncertain time, there is a lot of anxiety, sometimes a lot of depression surrounding this pandemic, not knowing if you are going to still have a job in the next 2 weeks, not knowing how you are going to pay your rent, not knowing how you are going to buy groceries. And this is not month's groceries in Barbados. There are a lot of households that are unable to buy groceries for the week, unable to buy groceries for a few days. And so with cross consultation, not just the medical professionals, but also getting an understanding of the economic concerns that the economists will have, certainly so that the society does not collapse on itself, we attempt to balance very delicately, because I won't admit, even as a representative of BAMP, this is something that, yes, we will always say we have to push for stronger healthcare measures, longer quarantine periods, for instance, lockdowns, even sometimes no movement days. But we also have to ask ourselves, are there other measures that, for instance, we can use to try to mitigate the risks of persons moving around, which eventually cause a lot more spread of the virus? You will see that in an international context, persons have mandated, for instance, vaccines. Persons have had no movement days. All of these are things because we recognize that it's not just healthcare workers, it's the wider body of frontline workers that really support our economy. So yes, there are benefits to lockdown in that it ensures the safety of persons, but even in locking down, I will say, especially for a very dense household, it is important that if you are aware that there's someone in the household that has been exposed, something as simple as when you are in that household, wearing your mask if you guys are in close contact is quite important. It allows for the safety within households. We are aware that there are times that we may have to wait a few hours for instance, collection to get to an isolation center, where ask the remainders of the family in the household to put on their mask to keep the rest of the household safe. So it is not just a matter of locking down for locking down's sake, but we look, as healthcare professionals, we always say safety first, but there is a wider picture essentially to understand for such. I don't know if Dr. Forde probably wants to say something.
Any other views on it? Dr. Forde?
I didn't realize I was on. Sorry about that. Yeah, so my only comment to this is, David, you asked a hard question. I'm not a policymaker. I only give advice based on medical experience and what's going on internationally. And I've always maintained that. I think the whole idea of lockdown, I think Dr. Grandison has really driven that quite nicely into that. And I think there are two legs one needs to think about. One has to and I think it's probably one of the most harshest words that's been used apart from the word COVID and Ebola. Everyone in the globe, you say the word lockdown, everybody wants to run away and hide, literally. And I don't like the word lockdown. I think the only way to stop the spread of the virus is for people to, one, wear a mask, and movement and spacing to be appropriate. And I think if we look at it from that perspective, then we might see things differently. It is quite challenging, I know, for all countries across the globe, especially countries with small economies, with challenges in terms of tourism, with challenges in terms of movement of individuals. I understand those challenges as well. From my position, in terms of infectious diseases, one of the most important things that I will always advocate in terms of stopping the spread of the virus is to stop or halt movement. How that is done can be variable. It doesn't necessarily have to be in a lockdown. It could be countries across the globe. Nobody has totally gotten this right. The great New Zealand, who had one case and locked down the country, is quite different to us. But I think we have to look at all the different measures that are in place. But I think the ones which are obvious, that we all know can impact the disease, are the things that we need to follow. And whatever other variables that need to be put in place, certainly need to be put in place. I'm already advising them. The EOC, Emergency Operation of Health, have already advised on these particular aspects. But of course, we're looking at health, but I think there are other variables that often need to be looked at. So I think as a fellow countryman in a country which is going through a difficult time, all entities can be on the table or should be on the table but they also obviously, from a different perspective, it's not only health, but other parameters that need to be considered. And the whole idea in terms of health, in terms of people with suicide, with mental illness, is another challenge. And I will say this, and say this again to every Barbadian, despite there's COVID, and despite we're dealing with all the other things with COVID, there are many other non-communicable diseases and complications of those that are occurring in the country. They have not stopped. They haven't gone anywhere. And as we deal with COVID, we need to look at those other entities as well. And that's going to be my answer to this particular question. I hate the word lockdown. You never hear me say that. It's only because I'm being asked. I hate the word lockdown. There are other methods or combination of methods that can look like a lockdown, but that's not necessarily total no movement. Thanks.
Thank you. The media is back with us. Let's take another question from them, and we will lock down this particular exercise in another 10 minutes. Thank you.
Good morning. Kareem Smith from Barbados today. This question is for both the CMO and Dr. Forde. Currently, public health workers, to the best of my knowledge, are not required to take the vaccine. Could you provide an update, Dr. Forde, on the percentage of workers in the isolation facilities that are vaccinated? And for the CMO, could you provide a percentage across the public health system? And for both of you, given the current strain that this particular wave is having on the public health system, do you agree with the suggestions from BAMP that in the best interest of the country, it's time to mandate the vaccine, at least for public health workers?
Karim, I know where you're going. Mandating of vaccines is a policy decision which will be determined by the policy directorate. I do not know. I can't say more on that. From a public health perspective, though, we would like to see as many people vaccinated as much as possible. How you get to that position is going to be guided by obviously the EOC weighing in and having an understanding of the public health science behind what we are trying to achieve. This question has been asked many times before. From a public health perspective, we would like to see a minimum of 80 to 90% of Barbadians vaccinated. How we get to that and how we get to that stage, regardless if it is mandatory or just by coercion, that's another issue. Furthermore, we have indicated in the public space that certain jobs, certain forms of employment require probably a different approach. And therefore, healthcare workers are one of those individuals, and believe it or not, many tourists who have come to Barbados are seeking to travel in taxis where they have verification that the taxi driver has been vaccinated. I agree with that. Because how could you ask an individual to come to Barbados vaccinated and then have somebody transport them who is not vaccinated? Persons who are taking care of vulnerable people in our hospitals, we have said so before, those persons should be vaccinated. And I believe, I speak under correction, the hospital is specifically addressing this issue because there are in certain situations, we must have cooperation or with the public with respect to having higher numbers. The other issue is in schools. We have always had in Barbados, always, that persons to enter schools must be vaccinated. Nobody questioned that over the years. Right? To get into secondary school is a requirement. To get into primary school is a requirement. And we all comply. But we are in a situation where everyone can ask a question disregard good science and make decisions how they are. From strictly a public health point of view, I believe schools should be made as safe as possible. And we need to do whatever it takes to make sure that those environments are protected. Thank you.
Dr. Grandison and Dr. Forde. Sorry, yes?
The first part of the question, for both the CMO and Dr. George, if they have the statistics, could you tell us what
We have
percentage of the
discussed
public
this
health?
before, Kareem. I indicated in the nursing homes across Barbados, we are at about 70 to 80% of staff and individuals vaccinated. In the psychiatric hospital, we are between 56 and 60% of the total component. I can provide this information with you. There has not been significant changes in those numbers. With the QEH, it depends on the individual staff members. So some staff groups have done better than other staff groups. But the issue is not necessarily the numbers which everyone wants to hear about on a daily basis. The issue is getting to a destination where Barbadians are safe. And that is if I give this type of advice this morning, that should be the outcome of this press conference. And not being, if psychiatric hospital has 60% versus 61%, we need those persons vaccinated because they look after vulnerable groups within our communities. Those people need to be protected. That's all.
Dr. Forde, do you have anything to add to it?
Final question for Dr. Forde.
Just hold on. I believe a question was posed to Dr. Forde by Kareem Smith. So
Good morning, good morning, Kareem. I hope you yourself are vaccinated. I would like to hear answers to that question because we like to ask difficult questions. I'm glad, fully vaccinated. Excellent. So I know you've called me on this before, and I'm going to give the same answer that I gave you the last time around. As it stands in our facility, across our isolation facilities, I could have told you a month ago that our percentage of fully vaccinated people had reached the 60, so about 64%. If we added persons who were in our system who had the first vaccine, because you know it's not that you get both vaccines at the same time when you're fully vaccinated. If you added that cohort of individuals now who had one shot of the vaccine, because you don't have Johnson & Johnson on the ground, then that number went up to about 74% between people who are partially and totally vaccinated at that point. With the advent of the burst in numbers across the community and the advent of the fact that we really went ahead of the facilities to train a large percentage of people, more 170 something extra people to help across housekeeping, orderlies. Now we added client agents at each facilities. That number and percentage now has shifted a bit down, obviously because we are bringing people in. And that percentage is now going to move in terms of people who've now had one vaccine, because we're now pulling people from the community to come to assist, and we're encouraging them to be vaccinated. I've always said 100% of the time it needs to be a choice. And I can't force the young people who come in to try to help us to do that. But I think from education and continuous education has allowed us to move that needle, that many of them have gone for vaccinations. I think this also clouded, and I think sometimes you need to, Kareem, as you think as a journalist, you also need to think about the different leg. Getting a vaccine, certainly when someone comes in, is not always hard and fast, because there are other vaccines that people are required to have as healthcare professionals when they come in, which would then mitigate the fact that they can't take this vaccine, as Dr. Grandison will tell you if you speak to her, at this particular point. So for example, many of these young people have come in, one of the major vaccines they also need to get is hepatitis B. But once you've got that vaccine, that sets back your vaccination time for COVID-19. So if they got that before they even came in as part of the pre-employment screening issue, then they'll be vaccinated. So many of them, it's not they don't want to be vaccinated, but because of the international guidelines, international strategies, that will follow. But I would say that many of them have now gone in to do the second vaccines. And I think the important thing is the continuous education process of individuals and making people comfortable. I've had many times where I've had sessions with the whole team, for especially many of them who've come in, for them to try to ask questions, bounce back and forth. You're only going to make people comfortable if you're going to be able to answer those questions, which may be coming up on social media, which may be coming up in newspapers, which may be coming out of social media. So the only way to try to address them is to address them head on. And I know many companies across the country, I don't want to call names lest I get in trouble, but many have contacted me and said, look, come talk to my workers. People have questions. I think once you address those questions, sometimes one-on-one, I've always said, and the CMO will tell you in these large meetings at the ministry, I always say, we have to go where it matters. We have to go into these sites. We have to go into the communities and talk to people and answer questions. We're sharp-footed because of what's going on now, but we got to do it. We got to go into the churches. And don't forget about my National Day of Prayer. I'm not going to let up on that one. But we need to go into businesses across the country. These are the areas that are being impacted right now. And that's how we're going to win. This is the only way we're going to win the battle, to go to people where they're at. You know,
Dr. Forde, thank you. Thank you very much.
Thanks.
And let me also extend my thanks also to the Chief Medical Officer of Health, Dr. Kenneth George, and to Dr. Adanna Grandison, and especially to those of you, the members of the media, who have come for this first press briefing of this type. We look forward to being with you at least once a week, and therefore we hope that we will be able to bring some of these individuals here with us today and others to you so that you can get the opportunity to hear from them directly on this issue of the fight against COVID-19. I'm David Ellis. Do have a good afternoon.